So like my partner said, drinking will increase drunk driving, and on average of 17,000 individuals each year are involved in drunk driving, and they're related to, are each year die each year in drunk driving related to deaths. While the number have come down slightly in 2010, for example, 10,228 died from drunk driving related fatalities, and drunk driving continues to be an enormously important publicly safety issue. Also, the binge drinking in the public interest, according to the Center for Science in the Public Interest, 44% of students attending four-year colleges drink alcohol at the binge level or greater. Fox News also reports that 157 college-age students drank themselves to death from 1999 through 2005. Given the epidemic of binge drinking among minors, lowering the drinking age would be subjecting a few dozen more Americans each year to the firing squad. And like my partner said, it would cause, alcohol is associated to violent and or destructive behavior. According to Johns Hopkins Bloomberg School of Public Health, alcohol is associated with an increased risk of positive sexual behavior, academic failure, drug abuse, and alterations to the structure and function of the brain. The National Institute of Alcohol Abuse and Alcoholism found that up to 86% of homicide offenders, 37% of assault offenders, and 60% of sexual offenders were using alcohol at the time of their crime. The National Minimum Drinking Age Act of 1984 has saved lives, and the article by Jessica Pauline Orgerville from the Los Angeles Times said that since the National Drinking Age Act of 1984 raised the drinking age to 21 in all 50 states, roads have become far safer and kids have delayed the onset of drinking. Back in 1970s, a number of states lowered the drinking age from 21 to 18, and we saw an increase in alcohol consumption by youth. When it was raised again in 1984 back to 21, we saw that lower consumption of alcohol, and they kept those low rates. The National Highway Safety Administration estimates that raising the drinking age to 21 saves lives about 800 lives a year. In fact, most public health groups, including the Centers of Disease Control and Prevention and the American Medical Association, kept the drinking age at 21. Also in 2007, a report published by a nonprofit organization called the Common Sense of Drug Policy stated that every year in the U.S. an average of 85,000 people died due to excessive alcohol consumption, and many people have a good time. Although many people could have a good time drinking alcohol, they do avoid the serious risks that can potentially kill a person if they drink too much. Teenagers especially do not know how serious the health risks are to drinking alcohol.